This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
It's
Supposed to
second.
help first or
Medical Dilemma.
Hi, I'm Sonny Del Rosario, and you're currently watching Medical Dilemma. Cosmetic surgery in all its forms has pervaded Philippine society, and the practice is experiencing unprecedented growth to a point that people are beginning to view cosmetics modifications as already mainstream. So has cosmetic surgery become a necessity, or is it just vanity? Or could we say that it has reached a record level of insanity? Let's take a close look at the medical and legal issues that surround cosmetic surgery in today's show. Now, joining me for our first segment is a plastic and reconstructive surgeon from the Cardinal Santos Medical Center, Dr. GERALD C.
Hi, good morning.
How are you, Dr. GERALD C?
Yeah, fine.
Yes. So I was informed that you're also the training officer of the plastic surgery section of Jose Reyes Memorial Hospital.
Yes,
Yes.
I'm currently the training officer for the section of plastic of
Okay.
Jose Reyes since 2009.
Okay, and you're also the vice president of PART1. Could you tell us what PART1 means?
Oh, PAPRAS is an organization that means Philippine Association of Plastic, Reconstructive, and Aesthetic Surgeons.
I see.
It is the society of plastic surgeons wherein everybody is, those who finish the training program are enjoying to, we invite them to become members of the organization. And in PAPRAS, as a plastic surgeon, we do what we call plastic surgery that involves reconstruction, burns, and of course the aesthetic or cosmetic component.
Okay. Well, just for the benefit of our viewers, let's discuss a few basic
Yeah.
questions about the practice of plastic surgery. My first question is, you know, we have these terms, cosmetic surgery, plastic surgery, reconstructive surgery. What are the differences among these?
Oh, for plastic surgery, before you become a plastic surgeon, there are certain requirements that you have to pass through, which means currently there are four training programs in plastic surgery. We have the PGH, UST, Consortium 1, Consortium 2, then we have the Visayas segment, and then the upcoming is the Davao segment. So the requirements is that you have to be in general surgery for at least a minimum of 3 years, after which you apply for plastic surgery training program. That is another 3 years.
Okay.
So when you finish the training program, you have to take the board exam, written exam and an oral exam, after which you become a fellow of the society, wherein we invite you to the society of PAPRAS. For cosmetic surgeons, the difference is that because of our prevailing medical act of 1959, that once you finish medical field, medical education in the Philippines, your title is physician/surgeon.
Physician/surgeon.
Yes. So some would prefer to have the training, shared trainings in our neighboring Asian countries like Thailand, Korea, nowadays in Korea, for certain procedures like nose surgery, rhinoplasty,
Okay.
eye surgery, blepharoplasty, breast augmentation, tummy tuck, and liposuction. The number of years that they went into training is not the same for plastic surgeons.
Okay.
So a plastic surgeon is always a cosmetic surgeon, but the vice versa is not applicable.
Okay, so it's not true.
that cosmetic surgeons are also plastic surgeons.
Mhm.
It may not be true because the plastic surgeon, as it implies, covers aesthetic, burns, and reconstructive procedures.
I see. Okay, well, I mentioned earlier during my introduction that the demand for plastic surgery services has been rising. Well, my question is the demand driven by consumer forces, or is it also driven by recommendations, medical recommendations by physicians?
Currently, kasi, it's because of partly, and a big chunk of that comes from the industry of beauty and wellness. Because of this marketing or advertisement done by other centers, it has come to a realization that beauty has to be something everyone should be able to have.
Mhm.
Okay, there are different facilities available there, different procedures, and people are now aware that they feel so conscious about themselves. If they are beautiful, then they can reach a higher level of what we call self-confidence or self-esteem.
Self-esteem.
And in terms of their achievements, they can achieve better. That has been shown in several studies.
Uh-huh.
So the procedure itself, in terms of the aesthetic requirements, is also industry-driven.
I see. Could you describe examples of cases that differentiate among plastic surgery, cosmetic surgery, and reconstructive surgery?
Again, plastic surgery covers the whole field.
The whole field.
The reconstructive part, which means to say, if, for example, there's a breast cancer patient who needs to have breast surgery, and there is a big defect, so who covers for that defect? The general surgeon will take out that tumor, and the plastic surgeon would now come in to reconstruct that particular area, the breast.
Okay, so that's reconstructive
That's reconstruction,
surgery.
reconstructive surgery. The same token, as we notice, there's so many motorcycles nowadays,
Yes,
and most of them are not wearing helmets,
yes, yes.
and they have accidents. Every day, there's almost 5 or 6 patients admitted for motorcycle accidents, and these are involving the facial structures.
So they
we
require
also do
reconstruction.
Reconstruction for facial injuries, bone fractures for these patients, and that's the reconstructive part. The burn part is when patients get burned either by flame burns,
Yes.
electrical burns, and for pediatric patients by what we call scalp burns. So we handle those burn patients. And of course, the aesthetic part, the cosmetic part. Normally, when we do our reconstructive cases, we try to come up with as most pleasing to cosmetic appearing, aesthetically pleasing appearance. Okay, that's for the reconstructive towards aesthetic.
Towards aesthetic.
But on a separate point, the cosmetic part of what we're doing, which is eye bag surgery, nose lift, breast augmentation.
So
tummy
these are
tuck.
more of enhancements
This-
of one's
yes,
appearance.
Yes, yes. These are really enhancement of one's appearance, and these are something that can, most patients would say, this will give me more confidence.
I see. Okay. Now let's go to the relationship between the patient and the physician. So if a patient approaches you and consults you for plastic surgery services, okay, how do you go about handling the interaction?
When a patient visits the clinic, most of the time patients would have already been through several.
It's like they have a fixed obsession already. I want my nose changed. something
Yes,
like
yes. So we usually ask, for me, what is your concern about your nose? So if the patient tells us that the concern of the nose is such as it doesn't have the height or the base
The
is so
bridge.
wide, if I can see that these are really, in reality, it can really help her in terms of her appearance, then we go ahead with the procedure. But before we do that, we explain to her the procedure step by step, and including the complications, because these are all part of what we call patient information. And the consent is what
Okay.
we're going to do with the patient.
Is some sort of a psychological examination
Yeah.
part of the process?
Yes, that's a very good question because in as much as when we see our patients, part of our assessment is also if they are realistic with what they want to achieve in the procedure. Because if they are not, then it's already a red flag for us. Especially there are patients who will not say that they have been to this doctor, then they have been operated, and they will not say, oh, this was something like, this was a scar. But you will be able to identify them eventually as you communicate with them.
I see. Okay, now let's reverse. Let's say this time it's the doctor that recommends a particular procedure to the patient. So how does the process differ from that of the first?
Yes, there are situations wherein doctors can recommend, especially for patients who are for functional reasons. Let's say burn patients who have scars that causes functional disability, so we can recommend. Then there are patients who have what we call congenital problems that can affect their function, then we can recommend also. For aesthetic cases, we recommend also in certain instances, such as if the patient says, Doc, tell me what is wrong with my face. Then I would always ask, what is your priority? What is your concern? Then I would tell them my opinion. Yes.
Okay. Is it possible that a doctor would refuse what a patient wants?
I have done that already because these patients may have a different perspective.
Yes.
So when we are communicating with them, we would be able to identify if they have sort of a BDD, we call them body dysmorphic disorder, or in a simple small change, they seem like it's too big imperfection for them, such that they cannot live with it. So when we are able to identify those patients, we try to tell them, maybe it's nice if we can talk to a counselor or a psychologist or psychiatrist at that, so we can really understand what your needs are.
I see. Now let's go over to the law. Okay. Currently, how is the industry regulated by law or the government?
Currently, plastic surgeons, most of the plastic surgeons practice in the hospital because of the requirements in the hospital in terms of the credentialing and the ethics committee. I am not quite sure if there is really a police body who handles all of these practices, the same cosmetic practices that we do outside of the hospital. In as much as you see that so many clinics who are performing what we call ambulatory surgery.
Yes.
Our society, PAPRAS, we're trying to police our own ranks. Which is to say, we try to see what our members are doing, and then we help them. But for other practitioners who do the same craft as we do, especially the cosmetic case, we let the other organization handle them, like the PMA, the PRC, or whoever's in charge for their activities.
I see. Okay. Well, what about in terms of ethical considerations? Is there a special set of ethical criteria that plastic surgeons observe, even though they're not stipulated by law?
Normally, kasi as we are being trained during our training program, training years, it's already being handed to us. There are certain unwritten ethical issues that we have to observe. Okay, and these issues, such as you don't want to recommend so much for a patient who comes in just for rhinoplasty.
Okay.
That's one. Number two, you just have to do what you can do. If you cannot handle that case, it's better to call for help. And you cannot just cover up anything without asking for help. So, and then when we do certain procedures, we have to make sure that bottom line there is the patient safe in our hands? I think that's the most important thing.
So it's the patient's welfare that prevails over everything else.
Yes.
Okay. Has your society been actively sort of promoting, this practice of ethics and other pertinent issues that need to be discussed in some sort of a forum or convention?
Yes, you are moving towards that. We're trying to set up what we call a lay fora or awareness as to what plastic surgery is all about and who are the plastic surgeons doing these kinds of procedure.
Yes, I think I will be part of that because I'm not really familiar
Yes,
with
yes.
everything that happens in plastic surgery.
And in our own little way or independent way, like, for example, I used to talk with Rotary for the
Yes.
spouses of the Rotarians about what is plastic surgery all about. So that's one way of giving information to our possible clients as to who they should go for that particular procedure.
I see. Okay, well, it's time for our commercial break. Okay, so thank you so much, Dr. C, for sharing with us information for our viewers. We'll be having a few words from our sponsors. Don't touch the dial, we'll be right back.
Many of our products were designed to be used in industrial and medical economy.